Hello everyone, welcome back to our channel. Today we're diving into an important health topic for diabetics medications that might pose higher risks than others. Now before we get started, remember I'm not here to scare you off your meds. This video isn't about making you ditch your prescriptions and go rogue. Instead, I want to empower you with knowledge. Understanding the potential risks associated with some common diabetic medications can help you have more informed conversations with your doctor. We'll be covering 7 medications or medication classes, delving into why they might be considered risky, and what alternatives might be out there. This is all about working your healthcare provider to make the best decisions for your individual health journey. So, if you're ready to become a more informed advocate for your own diabetic care, grab a glass of water, get comfy, and let's get right into it. First up on our list are sulfonylurias. These medications are designed to lower blood sugar levels by increasing insulin production in the pancreas. Sounds great in theory, right? And for many, they are effective. However, one of the biggest risks associated with sulfonylurias is the potential for hypoglycemia, or low blood sugar. Because these meds crank up insulin production, there's a chance your body might overproduce it, especially if you miss a meal or overdo it at the gym. Now, hypoglycemia might sound like no big deal, but trust me, it can be dangerous, even life-threatening in severe cases. We're talking symptoms like confusion, dizziness, seizures, even loss of consciousness. That's why it's crucial to be extra vigilant about monitoring your blood sugar levels while on sulfonylurias, and to always keep a source of fast-acting glucose nearby, just in case. Another issue with sulfonylurias is that they can lead to weight gain over time, not exactly ideal when you're trying to manage diabetes, which often goes hand in hand with weight management. Plus, long-term use of sulfonylurias can put a strain on your pancreas. Remember, we're forcing it to work overtime to produce more insulin, and eventually this can lead to the pancreas wearing out, which is definitely not what we want. The good news is, there are alternatives out there. Depending on your individual needs and medical history, your doctor might consider medications like metformin, DPP-4 inhibitors, or even newer options like GLP-1 receptor agonists. These medications often come with a lower risk of hypoglycemia and weight gain, and they work in different ways to help your body manage blood sugar levels. Remember, the key is open communication with your doctor. Next on our list we have meglitinides, another class of medications that stimulate insulin release from the pancreas. Now you might be thinking, hold on Dr. Mike, doesn't that sound a lot like sulfonylurias? And you'd be right to think that. They work in a similar way, and unfortunately that means they also share some of the same risks, particularly when it comes to hypoglycemia. While meglitinides are considered short-acting and tend to carry a slightly lower risk of hypoglycemia compared to sulfonylurias, the risk is still significant enough to warrant caution. This is especially true if you're older, have kidney or liver problems, or are prone to irregular meal schedules. Remember, anytime you're tinkering with your body's insulin production, there's always a chance of throwing things out of whack. That's why, once again, we need to be talking about alternatives. Besides the risk of hypoglycemia, meglitinides come with their own set of potential side effects. We're talking about things like headaches, upper respiratory infections, and even joint pain. Now, I know what you're thinking. Dr. Mike, don't all medications have side effects? And you're absolutely right. But it's about weighing the potential benefits against the risks. And in the case of meglitinides, when we have other effective options available, it might be worth exploring those alternatives with your doctor. Remember, managing diabetes is a marathon, not a sprint. We want to find solutions that are effective in the long run, without increasing your risk of other complications down the line. So if you're currently on meglitinides and have concerns, don't hesitate to speak up. Thiazolidinediones, or TZDs, are number 3 on our list of risky medications for diabetics. TZDs improve insulin sensitivity in muscle and fat cells, helping your body use insulin more effectively. However, there are serious risks associated with TZDs. These include heart complications like fluid retention, which can worsen heart failure. Discuss your individual risk factors with your doctor before starting TZDs. Another concern is bone loss, increasing fracture risk. This is particularly concerning for older adults. The decision to use TZDs should be made on a case-by-case basis. If you're taking TZDs, consult your healthcare provider with any concerns. One of the biggest challenges with TZDs is that the serious side effects can sometimes take weeks, months, or even years to develop. This can make it hard to identify the medication as the culprit, and patients may continue taking it while unknowingly experiencing harm. It's important to remember that managing diabetes is about finding the right balance between controlling blood sugar levels and maintaining overall health. While TZDs can be effective in lowering blood sugar, it's crucial to be aware of the potential long-term risks and to communicate openly with your doctor. If you're concerned about the risks associated with TZDs, it's essential to have an open and honest conversation with your healthcare provider. They can help you understand your individual risk factors and explore alternative treatment options that might be safer and more suitable for you. Remember, managing diabetes is a marathon, not a sprint. And finding the right treatment plan requires collaboration with your doctor, regular monitoring, and an understanding of the medications you're taking. Let's move on to number 4 on our list, non-selective beta blockers. Now, you might be thinking, wait, aren't beta blockers for heart conditions? And you'd be absolutely right. They are commonly prescribed to treat high blood pressure and other heart-related issues. But here's where things get tricky for diabetics. Beta blockers work by blocking the effects of adrenaline, which can be helpful for heart health, but can also mask the symptoms of low blood sugar, also known as hypoglycemia. This can be particularly dangerous for diabetics, as hypoglycemia can lead to confusion, dizziness, seizures, and even coma if left untreated. Now, this doesn't mean that all beta blockers are off the table for diabetics. There are selective beta blockers available that target specific receptors in the body and may be less likely to cause this masking effect on low blood sugar symptoms. However, it's absolutely crucial for diabetics to have a thorough discussion with their doctor about the risks and benefits of both selective and non-selective beta blockers before starting any new medication. This is not a decision to be made lightly. If you're diabetic and have been prescribed non-selective beta blockers, it's essential to be extra vigilant about monitoring your blood sugar levels. This may involve checking your blood sugar more frequently than usual, especially before, during, and after physical activity, as exercise can also lower blood sugar levels. It's also crucial to be aware of the signs and symptoms of hypoglycemia, which can include sweating, trembling, rapid heartbeat, dizziness, confusion, and difficulty concentrating. If you experience any of these symptoms, it's important to treat them immediately by consuming a fast-acting source of glucose, such as fruit juice or glucose tablets. Communication is key when it comes to managing diabetes and taking any medication, especially beta blockers. Make sure to keep your doctor informed about any changes in your blood sugar levels, new symptoms, or concerns you may have. Remember, your health is a partnership between you and your healthcare team. By working together and staying informed, you can make the best decisions for your overall well-being. Coming in at number 5 on our list of risky medications for diabetics are statins. Statins are widely prescribed to lower cholesterol levels and reduce the risk of heart disease, which is a leading concern for individuals with diabetes. While statins are generally considered safe and effective, recent studies have shown a potential link between statin use and a slightly increased risk of developing type 2 diabetes. The exact mechanism behind this association is still being investigated, but it's thought that statins might interfere with the body's ability to produce insulin effectively. Now, before you panic and flush your statins down the toilet, it's important to understand that the increase in risk is relatively small, and the overall benefits of taking statins for heart health might outweigh this risk for many individuals with diabetes. It's crucial to remember that managing diabetes is a balancing act. We need to consider the potential risks and benefits of each medication and treatment option carefully. If you're currently taking statins or are considering starting them, it's crucial to have an open and honest conversation with your doctor. Discuss your individual risk factors for diabetes, as well as your overall heart health. They can help you weigh the potential benefits of statins for your heart against the slight increase in diabetes risk. It's also essential to maintain a healthy lifestyle if you're taking statins, especially if you're at risk for diabetes. This includes eating a balanced diet, engaging in regular physical activity, and maintaining a healthy weight. These lifestyle modifications can help lower your risk of developing diabetes and improve your overall health. Remember, managing your health is a team effort. By working closely with your doctor, staying informed about your medications, and adopting healthy habits, you can make the best choices for your long-term well-being. And that's what it's all about, living a longer, healthier, happier life. Stay tuned as we delve deeper into our list of risky meds for diabetics. We've got more important information coming up, so don't touch that dial. Alright, moving on to number 6 on our list, niacin. You might know it as vitamin B3, and while it's essential for our bodies, high doses of niacin, especially prescription strength, can actually mess with your blood sugar. We're talking about the kind that's used to manage cholesterol, not the kind you find in your daily multivitamin. See, when you take high-dose niacin, your liver gets a little preoccupied. It's working overtime to process this influx of vitamins, and can sometimes fall behind on its other tasks, like regulating your blood sugar. This can lead to a spike in glucose levels, which is obviously not ideal when you're already managing diabetes. Now, this doesn't mean everyone with diabetes needs to ditch niacin completely. If your doctor has prescribed it for cholesterol management, don't stop taking it abruptly. What you should do is talk to them, let them know about your concerns, and discuss whether adjusting your diabetes medication or exploring alternative cholesterol treatments might be necessary. Remember, communication is key when it comes to managing your health. Your doctor needs to have all the information to make the best decisions for you. Now, if you're taking niacin and worried about its effects on your blood sugar, there are a few things you can do. First and foremost, talk to your doctor. They might suggest adjusting the dosage or timing of your diabetes medication to counteract any potential spikes. Alternatively, they might consider other cholesterol-lowering medications with a lower risk of affecting blood sugar. There are plenty of options out there, so finding one that fits your needs and lifestyle shouldn't be a problem. It's important to remember that managing diabetes is all about finding the right balance. That means weighing the benefits and risks of each medication and making informed decisions with your healthcare provider. And finally, a little reminder, never start or stop any medication without consulting your doctor. They're your partner in health, and their guidance is crucial in ensuring your overall well-being. And now for the final and perhaps most controversial medication on our list, exogenous insulin. Insulin is crucial for many people with diabetes. It's a lifesaver, literally, but it also comes with its own set of risks, especially with long-term use. One major concern is hypoglycemia, or low blood sugar. This can happen if you take too much insulin or don't eat enough. Severe hypoglycemia can be dangerous, even life-threatening. Another concern is weight gain. Insulin can lead to weight gain over time. Obesity can worsen insulin resistance, creating a vicious cycle. Insulin is necessary for many, but it's crucial to understand the risks and manage them effectively. So how do we mitigate the risks associated with exogenous insulin? Well, knowledge is power. Understanding how insulin works, how your body responds to it, and the factors that can influence your blood sugar levels is paramount. This means working closely with your doctor and diabetes educator to find the right insulin regimen for your needs, learning how to monitor your blood sugar levels effectively, and knowing how to adjust your insulin dose based on your meals, activity levels, and overall health. Remember, managing insulin therapy is a bit like walking a tightrope. You need to find the sweet spot, enough insulin to keep your blood sugar in check, but not so much that you risk hypoglycemia. It takes practice, patience, and open communication with your healthcare team. And finally, don't be afraid to advocate for yourself. If you're experiencing side effects, if you're struggling to manage your insulin, or if you have any concerns whatsoever, speak up. Your voice matters, and your health is worth fighting for. That wraps up our list of risky medications for diabetics. Remember, this video is for informational purposes only and is not intended to provide medical advice. Always consult with your doctor before making any changes to your medication. Thank you for watching. Make sure to follow us on all social media platforms and YouTube at Diabetes Daily Dose. Also, make sure to like, follow, comment, and subscribe. Remember, managing diabetes is a journey we're on together. Stay healthy and informed.